Hi guys, and welcome back to EverlastCyber. In today's video, we'll be covering some multiple choice questions on the human hearts. So let's start right off with question 1. Which chamber of the heart has the thickest myocardium? A. Right atrium, B. Left atrium, C. Right ventricle, D. Left ventricle. Let's look at the options we have. So the right atrium receives deoxygenated blood from the vena cava, and its job is to push blood a short distance into the right ventricle. Now, because the workload is low, the muscle wall is very thin. So this is not the correct answer. The left atrium receives the oxygenated blood from the pulmonary veins, and it only needs to move the blood a short distance to the left ventricle, which is right below it. Now, although it is slightly thicker than the right atrium, it is still much more thinner than any ventricle. So this also is not our answer. The right ventricle pumps blood to the lungs through the pulmonary artery, and the pulmonary circulation is basically low pressure because the lungs are close to the heart. So it only needs moderate force, which makes its wall a bit thicker than the atria, but it is still much thinner than the left ventricle. The left ventricle has the thickest myocardium of all the chambers of the heart. The heart has 4 chambers, but the left ventricle has the thickest myocardium because it has the hardest job, which is pumping oxygenated blood to the entire body through the systematic circulation. Now, it generates high pressure that is needed to push blood through all the arteries and reaches distant organs like the brain, the kidneys, and the legs. So because of the hard job it does, the walls have to be strong and thick. So this brings our answer to option D. The left ventricle has the thickest myocardium because it has the hardest job of pumping oxygenated blood to the entire body through the systemic circulation. Question 2. The inner lining of the heart is called the A. Myocardium, B. Pericardium, C. Epicardium, D. Endocardium. The myocardium is the middle layer of the heart, and it is made up of cardiac muscle, which is responsible for the contraction that pumps blood. The pericardium is the outer covering or the sac that surrounds the heart. It has 2 layers, which are the fibrous layer and the serous layer, and it contains the pericardial fluid. Its job is to protect, anchor, and lubricate the heart. The epicardium is the outermost layer of the heart wall. It is also called the visceral layer of the serous pericardium, and it covers the surface of the heart, so it is not the inner lining. The endocardium is the innermost layer of the heart. It basically lines the heart chambers, the inner surface of the myocardium, and the valves. It is smooth and thin, and it helps to reduce friction as blood flows through the heart, thereby preventing clot formation. So our answer here is option D. The endocardium is the inner lining of the heart. It lines the heart chambers, the valves, and the inner surface of the myocardium. Question 3. What is the primary function of the human heart? A. To produce hormones, B. Digesting food, C. To pump blood, D. To filter toxins. The heart does not produce hormones. However, there's just one type of hormone that the heart produces, which is the atrial natriuretic peptide. This hormone has a secondary function. It helps to regulate blood pressure and fluid balance, but this is not the main function of the human heart. Digesting food is the job of the digestive system, which is mainly the stomach and the intestines. So, this is not a function of the human heart. The primary function of the human heart is to pump blood throughout the body. Now, this pumping action delivers oxygen and nutrients to the tissues that needs them. It removes carbon dioxide and waste products, and it helps to maintain blood pressure. Without this constant pumping of the heart, the organs and the tissues would not receive the substances that they need to survive. In option D, filtering of toxins is handled by the liver and the kidneys, not the heart. So our answer here is option C. The primary function of the human heart is to pump blood. Question 4. The heart sound loop is caused by the closure of which valves? A. Aortic and pulmonary. B. Mitral and tricuspid. C. Tricuspid and pulmonary. D. Mitral and aortic. The aortic and pulmonary would not be the correct answer because these valves produce the second heart sound known as the dub. So they close at the end of systole but not at the beginning. The lobe is the first heart sound and it is produced by the closure of the atrioventricular valves, which are the mitral valve that is situated between the left atrium and the left ventricle, and the tricuspid valve, which is between the right atrium and the right ventricle. The valves close at the beginning of the ventricular systole, which is when the ventricles start to contract. This prevents blood from flowing backward into the atria. In option C, the tricuspid and pulmonary mixes one AV valve with one semilunar valve. This is incorrect. And in option D, this is also incorrect because the combination of the mitral and the aortic does not produce the lobe sound. So our answer here is option B. The mitral and tricuspid valve is the one that is responsible for the first heart sound, which is known as the lobe. Question 5. Which chamber of the heart receives deoxygenated blood from the body? A. Right ventricle. B. Left ventricle. C. Right atrium. D. Left atrium. The right ventricle receives blood from the right atrium, not directly from the body, and it pumps the deoxygenated blood to the lungs, not from the body. So this is different from the question that was asked. The left ventricle contains oxygenated blood, which it pumps to the whole body. It does not receive blood from the body. The right atrium is a chamber that receives deoxygenated blood from the body. So this blood returns from the tissues through two major veins, which are the superior vena cava and the inferior vena cava. The deoxygenated blood enters the right atrium, which then sends it to the right ventricle for pumping into the lungs. In option D, the left atrium receives oxygenated blood from the lungs, not deoxygenated blood from the body. So our answer here is option C. The chamber of the heart that receives deoxygenated blood from the body is the right atrium. Question 6. The pacemaker of the heart is the A. AV node, B. Purkinje fibers, C. Bundle of His, D. Sinoatrial node. The AV node or the atrioventricular node receives impulses from the SA node, which is a sinoatrial node. It delays the signal briefly to allow the ventricles to fill, but this is not the primary pacemaker. The Purkinje fibers carries electrical impulses into the ventricular walls to cause a contraction. They do not initiate the heartbeats. The bundle of hairs is a structure that transmits impulses from the AV node to the ventricles. However, it is not the pacemaker. The sinoatrial node or SA node is the pacemaker of the heart because it initiates the electrical impulses that starts each heartbeat. It also sets the normal rhythm and rate of the heart, which is typically around 60 to 100 beats per minute. So our answer here is option D. The pacemaker of the heart is the SA node or the sinoatrial node. Question 7. A 72-year-old woman presents with shortness of breath when lying flat and swollen ankles. On exam, you hear S3 gallop. What is the most likely diagnosis? A. Asthma. B. Pulmonary embolism. C. Congestive heart failure. D. COPD. Asthma is incorrect because asthma causes wheezing and difficulty in breathing. But in the scenario we have, it's mentioned that the woman has swollen ankles and she has shortness of breath when laying flat. This is not a symptom of asthma. Pulmonary embolism is incorrect as well because it causes sudden shortness of breath and chest pain, but swollen ankles is not one of the symptoms. For pulmonary embolism, the symptoms are sudden, so this is not the correct answer. In this scenario, the patient is showing classic signs of congestive heart failure, and the key clues to this are: first, the shortness of breath when laying flat, which is orthopnea. It when she lays flat, it causes fluid backing up into the lungs. Another symptom is the swollen ankles, which is peripheral edema. This is fluid retention from poor cardiac outputs. Another symptom mentioned is the S3 gallop. This is a hallmark sign of left-sided heart failure, and it indicates increased ventricular filling pressure. So these three symptoms that have been mentioned, when they are put together, they strongly point to congestive heart failure. COPD would be incorrect because it causes chronic coughing, sputum, and wheezing, but these are not mentioned in the scenario. So our answer here is option C. These are classic signs of congestive heart failure. Question 8. Which blood vessel carries oxygenated blood from the lungs to the heart? A. Pulmonary artery. B. Superior vena cava. C. Pulmonary veins. D. Coronary sinus. In this, we'll be going with option C. The pulmonary veins are the only veins in the body that carries oxygenated blood. Their primary job is to transport this freshly oxygenated blood from the lungs to the left atrium of the heart. This oxygen-rich blood is then pumped into the left ventricle and then out to the rest of the body. Question 9. How many chambers does the human heart have? A. 5, B. 4, C. 3, D. 2. Our answer here is option B. The human heart has 4 chambers and they work together to pump blood throughout the body. Now, one of the chambers is the right atrium, Its job is to receive deoxygenated blood from the body. There's the right ventricle, which pumps deoxygenated blood to the lungs. The left atrium receives oxygenated blood from the lungs, while the left ventricle pumps oxygenated blood to the body. Now, the four-chamber structure allows efficient separation of oxygenated blood and deoxygenated blood, thereby ensuring that the body gets a continuous supply of oxygen-rich blood. Question 10. What is the name of the valve between the left atrium and left ventricle? A. Mitral valve. B. Tricuspid valve. C. Pulmonary valve. D. Aortic valve. The mitral valve, which is also known as the bicuspid valve, is located between the left atrium and the left ventricle. Its major function is that it allows blood to flow from the left atrium to the left ventricle during atrial contraction. It also prevents backflow by closing when the left ventricle contracts. It is named mitral because it looks like a bishop's mitre or hat. The tricuspid valve is located between the right atrium and left ventricle, so this is not correct. The pulmonary valve is located between the right ventricle and the pulmonary artery, so this is incorrect. The aortic valve is located between the left ventricle and the aorta, but with respect to the question, the correct answer is option A. The mitral valve is located between the left atrium and left ventricle. Question 11. A 45-year-old patient complains of a fluttering heartbeat. ECG shows absent P waves and irregular rhythm. What condition is this? A. Ventricular tachycardia. B. Atrial fibrillation. C. Atrial flutter. D. Sinus tachycardia. In this scenario, ventricular tachycardia would be incorrect. Ventricular tachycardia originates in the ventricles, and the ECG would show wide QRS complexes and rapid regular rhythm, but this is different from the scenario we have. This patient's ECG findings and symptoms point to atrial fibrillation because of the palpitations, and these palpitations are common in AFib. The absent P waves on the ECG shows that the atria are not contracting normally, and then the irregular rhythm shows that the ventricular response is irregular. AFib is basically caused by disorganized electrical impulses in the atria, thereby leading to ineffective atrial contraction. So this is our answer, option B. This condition is known as the atrial fibrillation because of the symptoms that have been presented. Question 12. What condition is characterized by a buildup of fatty deposits in the arteries, restricting blood flow? A. Arrhythmia. B. Aneurysm. C. Atherosclerosis. D. Hypertension. Arrhythmia refers to abnormal heart rhythm, but it doesn't point to any blocked arteries. So this is not our question. An aneurysm is a localized ballooning of a blood vessel which can rupture, but this is not caused by fatty buildup. Atherosclerosis is a condition where fatty deposits build up inside the walls of arteries, thereby leading to reduced blood flow to organs and tissues, and it has an increased risk of heart attack, stroke, and even peripheral artery disease. These fatty deposits are also known as plaques, and they consist of cholesterol, fats, calcium, and cellular debris. So this often progresses silently until there's a significant blockage. Hypertension is high blood pressure and it can contribute to atherosclerosis, but it is not the condition itself. So our answer here is option C. Atherosclerosis is a condition that is characterized by a buildup of fatty deposits in the arteries, thereby restricting blood flow. Question 13. What is the average resting heart rate for adults? A. 60 to 80 beats per minute. B. 100 to 120 beats per minute. C. 40 to 60 beats per minute. D. 120 to 140 beats per minute. For this, we'll be going with option A. The average resting heart rate for a healthy adult is generally 60 to 100 beats per minute. Most adults fall into this range when they are at rest. However, heart rate can be influenced by age, medications, health conditions, and fitness levels. Now, some well trained athletes may have a lower resting heart rate, which is sometimes between 40 to 60 beats per minute, but this is considered normal for them because of their lifestyle, because of their fitness level. A heart rate of 100 to 120 beats per minute indicates tachycardia, which is abnormally fast heart rate at rest. 40 to 60 beats per minute is slightly below average, but it may be normal in athletes because of their fitness level. 120 to 140 beats per minute is definitely abnormal at rest, and this should be considered as tachycardia. But for an average adult, the resting heart rate is 60 to 80 beats per minute. Question 14. Which valve prevents backflow into the right ventricle? A. Aortic valve. B. Mitral valve. C. Pulmonary valve. D. Tricuspid valve. For this, we'll be going with option C. The pulmonary valve is a semilunar valve that is located between the right ventricle and the pulmonary artery. Its main function is to prevent blood from flowing back into the right ventricle after it has been pumped into the pulmonary artery. It opens during ventricular systole, which is contraction, and closes during diastole, which is relaxation. So that is the valve that prevents backflow into the right ventricle. Question 15. Which ion is crucial for cardiac muscle contraction? A. Sodium. B. Potassium. C. Chloride. D. Calcium. Sodium is incorrect because it is not directly responsible for contraction. It is important for initiating the action, but it is not responsible for the contraction itself. Potassium is essential for repolarization, but it does not trigger contraction. Chloride ions helps to maintain electrolyte balance and resting potential, but they are not crucial for cardiac muscle contraction. The ion that is crucial for the cardiac muscle contraction is calcium. Calcium ions play a critical role in cardiac muscle contraction. So, when an action potential reaches the cardiac muscle, calcium enters the myocytes through voltage-gated calcium channels. The calcium binds to troponin, causing a conformational change that allows actin and myosin filaments to interact. This interaction is what produces the muscle contraction in the heart, also known as systole. Question 16. A 19-year-old athlete collapses during training. ECG shows prolonged QT interval. What is the most likely cause? A. Hyperkalemia. B. Hypocalcemia. C. High sodium. D. Dehydration. Hyperkalemia is incorrect because high potassium shortens the QT interval initially and can cause peaked T waves, but not prolonged QT. A prolonged QT interval on ECG indicates delayed ventricular repolarization. This can predispose to dangerous arrhythmias, and in a young athlete, this can occur due to electrolyte imbalance, intense exercise, or dietary deficiency. In option C, high sodium would be incorrect because sodium levels mainly affect depolarization. Dehydration may affect electrolytes indirectly, but it is not a direct cause of the QT prolongation. So our answer here is option B, hypocalcemia. Question 17. What is the role of hemoglobin in the blood? A. Producing antibodies. B. Regulating blood pressure. C. Fighting infections. D. Carrying oxygen. For this, we'll be going with option D. Hemoglobin is a protein that is found in the red blood cells, and it is responsible for transporting oxygen from the lungs to the tissues. Hemoglobin also helps to carry a small portion of carbon dioxide from the tissues back to the lungs for exhalation. Question 18. The heart muscle receives blood during A. Ventricular systole, B. Atrial systole, C. Ventricular diastole, D. All phases of the cardiac cycle. For this, we'll be going with option C. The coronary artery supplies blood to the heart muscle or the myocardium. Now, blood flow to the heart muscle occurs during ventricular diastole, which is when the ventricles are relaxed. During systole, the contracting ventricles compresses the coronary vessels, thereby reducing the blood flow. So the myocardium gets most of its oxygen and nutrients when the ventricles are relaxed. And that is why we are going with option C, the ventricular diastole. Question 19. What is the term for the period of relaxation of the heart chambers during the cardiac cycle? A. Diastole, B. Systole, C. Conduction, D. Fibrillation. Our answer here is option A. Diastole is the phase of the cardiac cycle where the heart chambers relaxes. During diastole, the ventricles fill with blood from the atria, and the coronary arteries receive most of their blood flow to supply the myocardium. Systole comes after diastole, and this is a phase of contraction where the heart pumps out blood. Question 20. Which of the following factors can contribute to the development of heart disease? A. Regular physical activity, B. Smoking, C. Low blood sugar, D. High HDL cholesterol. For this, the correct answer is B. Smoking is a major risk factor for heart disease because it damages the lining of the arteries, it promotes plaque buildup, it increases blood pressure and heart rate, and it increases the risk of heart attacks, strokes, and peripheral artery disease. This brings us to the end of the video for the human heart's multiple choice questions. Don't forget to like, comment, and share, and also hit the subscribe button so you'll be informed when our next video will be dropping. Thank you for watching.